Hello, my name is Jinyoung. Today I'd like to talk about refractive error and laser refractive surgery to address them. I'd like to introduce you a new surgery called SMILE and discuss how it's different from the other laser vision correction procedures. For the details, I will cover who can be a candidate of those surgeries, what are popular vision correction procedures, and the advantages and disadvantages of each procedure. Patients who seek vision correction usually have a broad vision. This broad vision is called refractive error. Among many different types of refractive errors, the most common is the nearsightedness, in other words, myopia. With the patient who have myopia, their eyeball is too long, they find the light to incorrectly focusing image in front of retina. With the condition, patients have their distance vision is very blurry, but near vision is very good. The opposite refractive error is farsightedness or hyperopia. In this situation, their eyeball is too short. The light comes into focus behind the retina. Patients with hyperopia will feel their distance vision is good, but their near vision is blurry. A third type of refractive error is astigmatism. In this condition, the light comes into focus at two separate points, which creating a blur. It occurs when the cornea is irregularly shaped. This irregularly shaped cornea will distort vision from both near and far distances. If a patient has a refractive error and they are seeking to get out of contact lens glasses and their prescription has been stable for over 1 year, they can be candidate for laser vision corrections. The first type of laser refractive error surgery is called PRK, photorefractive keratectomy. In this procedure, the most superficial layer of the cornea, called the epithelium, is removed. And then, laser is used to reshape the cornea, followed by placement of bandage contact lens. Advantage of this surgery is that it is safer for patients with thinner cornea because it manipulates less tissues. Disadvantage is that it takes a while to vision to recover, so it could be take up to 1 or 2 months to get the perfect vision. Moreover, patient will experience some intermittent light sensitivity, tearing, and burning for a few days while the contact lens in. And there risk transient ocular dryness that can last 3 or 6 months, nearly up to 1 year. A second type of laser refractive surgery is LASIK, for laser assisted in situ keratoconiosis. In this surgery, laser creates a flap of tissue in the cornea. And then second laser reshape the cornea and then place the flap back down. This is probably the most commonly used procedure for nearsightedness, farsightedness, and astigmatism, and is probably popular because the vision is usually excellent the next day. Patient will have a few hours of burning and tearing after the procedure. But it has also similar kind of ocular dryness risk that PRK has. Last, the third surgery I'd like to introduce you is called SMILE, small incision lenticular extraction. It's been available internationally for over 10 years. It was FDA approved for myopia in 2017 and for astigmatism in 2018. The laser creates a reticular disc shape in the cornea. It's also going to make a small incision, which is about 3 millimeters. And surgeon can then access this reticular disc shape of tissue through the small incision and remove it from the cornea. About the surgery, SMILE has the shortest duration of the burning and the tearing, maybe 1 hour. It has a medium visual recovery time, so it's not as fast as LASIK, but it's not as slow as PRK. Most patients can see very well within 2-3 days. Overall surgery, it has the lowest risk of dry eye because that incision is very small. In summary, patients who have refractive error and desire to get out of glasses and contact lens, if they have had a stable prescription and they have no any other medical eye conditions, they can be candidate for laser vision corrections. All 3 types of laser correction are very excellent. So patient and surgeon can decide together which is the most appropriate procedures for that patient. Thank you for listening.